Hello friends, I'm sure you're doing great. I'm Dr. Arshad Nadeem Awan with my ultrasound and radiology teaching video. Today I'm going to talk about the adrenal gland calcification. While you are reporting CT scan or MRI, or sometime it is likely possible to see on the ultrasound imaging while there is any tumor. There is a wide differential diagnosis for the adrenal calcification. On the top there is tumor, so it could have been possible because of the neuroblastoma or few chromocytoma. Certain infection also causes calcification of the adrenal gland, like tuberculosis, toxoplasmosis. Beside this, if there is any traumatic condition which leads to hemorrhage, so hemorrhage also lead to cause the calcification in the adrenal gland. And congenital abnormalities also causes calcification within the adrenal gland. There is a wide list of the differential diagnosis. In this consecutive slides, I have mentioned the differential diagnosis. Let's start watching the images. For the adrenal gland calcifications, two major tumors are responsible. If there is neuroblastoma and if there is few chromocytoma, these two are the tumor which arise from the adrenal gland and give rise to calcification. When you observe calcification on the CT images within the adrenal gland, this could be neuroblastoma or this could be few chromocytoma. You must compare it with the clinical and laboratory investigations as well. As far as infections are concerned, some infections give rise to adrenal calcification, and the topmost is tuberculosis. After the tuberculosis, you may list the histoplasmosis as second, and the third thing, which is called as Waterhouse-Friderichsen syndrome. Actually, in Waterhouse-Friderichsen syndrome, what happens is adrenal gland failure occurs because of the bleeding. So whenever there is adrenal gland bleeding occur, as a result the adrenal gland lost its activity, its failure take place, and it no longer remain in active condition. As a result, you will see multiple calcification in there. That would be because of this particular Waterhouse-Friderichsen syndrome. If there is any hemorrhage because of any trauma or iatrogenic condition, or because of due to any interventional procedure, if there is any hemorrhage, and hemorrhage will give rise to calcifications as well. So you must think of the traumatic stage. If there is any calcification, you can see on the CT images. Wolman disease is a congenital disease in which you can appreciate calcification within the adrenal gland. What happens in the Wolman disease is it is characterized by impaired metabolism of the fat. So in this disease, which is congenital, there is impairment of the metabolism of the fat. As a result, in the adrenal gland you may be able to see the calcifications.